Good afternoon. Hi, I'm Dr. Doug Cluff. I have a practice that is an affordable membership model of primary care called Direct Primary Care, and the name of the practice is TLC Family Health. And I thought it would be appropriate to give you a virtual tour so you can learn a little bit about the where and the what. And I will go ahead and flip it to the other camera. So here we are. This is my practice, TLC Family Health. We are at 2601 Church Hill Drive in Flower Mound, Texas. This building used to be all by itself back here, and now they have a big development going up next to us. And also we have a couple of lots that the town of Flower Mound bought, and they took the houses down and they're going to build the Church Hill extension through there so that it T-bones the next street over, which is called Yucca. So this is my practice, and forgive the amateur nature of the video, but that's not my business. I'm in healthcare. Alrighty. So when you walk in, here is my medical assistant, Jessica. Say hi. And around the corner is Frida. She's interning or externing with us, whatever you call it. But this facility used to be rented by the Dallas Cowboys, believe it or not. And their Primetime Sports, which is a 3-on-3 basketball tournament company, was headquartered here. But this is my waiting room. It's not huge because we don't want people to wait. And I didn't spend a lot of money on waiting room furniture because I bought a bunch of chairs for our conference room. I'll show you that in just a little bit. But there's our TV. I took this waiting room. There used to be a door over here to the left, but we didn't need two doors. And so we filled that in. I took this wall right here and it moved it over so that it's halfway between a checkout and a check-in window, even though people don't pay when they come in because we do everything online. But I turned this into a front office. I built this window so that they could see out, this one over here, and turn this into a front office. And this area right here, this used to be just a hallway, kind of about, I'm going to make you dizzy here, about the same width as this hallway. We're doing some cleaning here. And but right there used to be a closet. And that closet was a great place to put a medical assistant space. So once we grow and fill up, we'll turn that into a medical assistant area. What's sad is that we took the closet out, and after it was all done, I realized that was my only closet. So right now we don't have a formal closet. I will show you that, our little makeshift closet, in a bit. Anyway, we have 5 exam rooms. I've only outfitted a couple of them. This is kind of for storage, our little kids' plaything. We weigh people in here. This is kind of our triage area. And then here is Frida practicing by giving Jessica a shot. But I have 2 rooms that I've outfitted, and want to try to keep costs down because I've got 3 others that I will furnish when the time comes. So those are my 2 rooms. And then we have over here a men's bathroom. It's kind of large. We're going to turn it into 2 unisex bathrooms along with the women's, just because of the fact that we're going to have a goodly number of people hopefully coming in to our conference room. So this was one of the exciting things. I did not have to build this. This was already here. And a major part of my model is group instruction. So group instruction has been found to decrease healthcare costs, improve quality of care, and improve patient satisfaction, the trifecta. But insurance doesn't pay for them. So now that I am outside the world of insurance, I don't care. We actually held tastings for my hopefully upcoming restaurant called Holy Caboli here recently. And anyway, had to take a little break there. But that's my the 4th exam room right there. unfurnished. And then my 5th exam room, unfurnished. So right behind this wall is my lab, and I'm actually going to put a door there eventually because we'll wall that off. For right now, it's another big room that I'm currently using to store chairs. Right there is where I'm going to put my closet when I can afford to. But right now, this is serving as a large, spacious area that will eventually become my radiology suite. So once I can get that rolling, I will have a full service thing here. There is my lab, and like I said, I'm going to put a door there and wall this off. Right now we draw blood in the rooms because we don't need to move people for right now. Going back down this hallway, there's the women's bathroom. And then here's our very tiny break room, which you can see I spent a lot of money on high-end furniture. Eventually we'll have to create a bigger break room. Coming around here, though, is what is going to be our subspecialty subleasing room. I've got 4 carpeted rooms. Each has serves a purpose. And I want to have a cardiologist on Monday, an endocrinologist on Tuesday, that kind of thing. Subspecialists like often to sublease in a thriving family practice because it's a ready referral source for them. We love it because it's a ready consultation source, helps to pay rent. Patients love it because they don't have to go to some big medical center to see their specialist. So that's what the purpose of that room is, and hopefully that will serve its purpose. Now behind this door is our counselor's room. So as part of the model of TLC Family Health, we have a licensed professional counselor, Gail Hartshoe. She's awesome. And then Jennifer Franson is our nutrition coach, who also offices out of here. It's actually the only room that we've spent money on to furnish because people need to have a good experience when they're in counseling situations. All right, and then we go back around. I hope you recognize that. It's basically a square, and right here is where the offices are. So back here is our utility closet. This is my office, and pretty simple. You can see up here I'm a Doctor Who fan, and this is a big enough office to where you could put 2 providers, but right now it's just me. And then the second office is currently our closet. So close your eyes. I don't want to see the mess, but this is the second office that again could hold 2 providers if needed, but right now we're using it for storage until I can get my closet built. All right, so lastly, this is kind of a fun thing. We have, oh, by the way, there's my family. We are missing an upcoming son-in-law that's going to be marrying this gal here. These 2 are married, and then I have a total of 6 of my own children. And these 2 that are married created a beautiful granddaughter for us in June of 2018, who we, of course, adore. And this is our toy closet, so it's kind of fun. After each visit, children and their siblings, we don't care, can come and open this up and see what we have to offer. Nothing terribly expensive, but just kind of a fun little ritual that we have at the end of each visit for kids. Anyway, so that, and then right here we have our eye chart and stuff. We have a kids one superimposed on the adult one to remove whenever we need it. And that pretty much sums up TLC Family Health, the virtual tour, and we hope you will come to join our TLC family.